Thank you so much for joining us again live on Instagram. And thank you for everybody that is watching this now or on the recording. I'm going to just do a quick introduction of Dr. Mack before we get started, and then we will dive into the conversation. So for those of you that didn't watch our first conversation with Dr. Mack back in December of last year, she is an assistant professor at Dell Medical School at University of Texas, Austin, and a board-certified reproductive endocrinologist. She's also the director of the Early Pregnancy Loss Program at UT Health Austin. Dr. Mack completed medical school at the United Medical and Dental Schools of Guy's and St. Thomas Hospitals in London, and then did her OB-GYN residency at Addenbrooke's Hospital in Cambridge and St. Mary's Hospital in London. After that, she then received a PhD in genetics from Imperial College London and did a second residency in OB-GYN at Cedars-Sinai in Los Angeles, and then a fellowship in reproductive endocrinology and infertility at University of Pennsylvania. She was recruited to be an NIH research scholar at Yale, focusing on reproductive biology, where she discovered a protein that is important to early embryo development. And she also was the director of Yale's Recurrent Pregnancy Loss Program during the time that she was there. So her current research focuses on identifying new causes for unexplained recurrent pregnancy loss. And so if that isn't enough reason why we would be excited to talk to her, she also blogs and posts on Instagram to help educate people about pregnancy loss and causes and treatments and things like that. So if you don't follow her already, it's Miscarriage MD. And she keeps the blog, but also the account on Instagram as well. So thank you so much for being with us here today. Is there anything you want to add or anything you'd like to say generally about the topic before we dive in?
Well, thanks for inviting me again. And it's great to, sort of do this and really sort of talk about sort of new things that are happening in recurrent pregnancy loss. So I'm excited to be here again.
Awesome. Thank you. We are excited that you agreed to talk to us about this topic. And I do want to caveat up front. So I'm going to ask you a bunch of questions, but for everybody watching, male factor and its contribution to recurrent pregnancy loss is still, my understanding, a very moving target. There's still a lot that's unknown and the science is still pretty early stages. Is that a fair assessment?
Yeah, so definitely we have basically been focused on the women for a long time in the research arena, and really more recently has it been coming to sort of interest that, oh, wow, the guy has a role to play in this, surprisingly. And I think, that's the next sort of area of research that we need to focus on, is really looking at the guy too, because yes, there are reasons for the woman, but there are two people in this making a pregnancy. So I think it's time to sort of delve deeper on the guys.
Okay. And so with that in mind, what exactly when we're talking male factor as it relates to miscarriage, what does that mean? And how is that the same or different than when you hear people talk about male factor as it relates to infertility?
Okay, so that's a great question. So right now, the workup for recurrent pregnancy loss per ASRM for the male is just to do one blood test, which is the karyotype, to look at if they have any genetic disorder where their chromosomes have translocations, i.e. the chromosomes are a little wonky, and this could be a reason. So that's the only test that ASRM suggests that we do. And the likelihood of finding anything with that is about 4% of couples have, either the man or the woman have some genetic translocation of the chromosomes that could lead to recurrent pregnancy loss. But then there's nothing else. And in infertility, we look at least the semen analysis. So to look at the quantity, the motility, and the percentage of normal looking sperm. And so for male infertility, when we talk about male factor in infertility, we're looking at sperm. And that's a whole different conversation also, that we should be studying more male factor infertility. And it's not just the quantity of sperm. You can have normal looking sperm, but other things could be an issue. So that's kind of a different conversation for a different day. But focusing on recurrent pregnancy loss, definitely a lot of the research has been focused on sperm. And so because of male infertility is sort of characterized by semen analysis, then people have looked at recurrent pregnancy loss and semen analysis, and they have found that partners of women who have recurrent pregnancy loss or unexplained recurrent pregnancy loss, they may have abnormal semen parameters. So similarly, there could be something sort of wrong with the sperm. So that's one. And then the really sort of hot topic right now in both sort of male infertility and sort of recurrent pregnancy loss is sperm DNA fragmentation. And what sperm DNA fragmentation is basically the sperm is really sort of the DNA of the sperm. It's very tightly bound in the head of the sperm. However, there are areas where it could be exposed to DNA damage. And so that is what the tests for sperm DNA fragmentation are looking at, is the DNA damage in the sperm. And there's a lot of studies in animals that suggest, ionizing radiation, such as from a nuclear, say if you had a nuclear bomb or nuclear reactor, that's ionizing radiation, and they've exposed animals, male animals, to ionizing radiation, and they've to sort of cause abnormal or high sperm DNA fragmentation, and they've noticed that they're more likely to have pregnancy loss in those animals, and there are genetic disturbances in even the live-born animals. So definitely the integrity of the sperm, the DNA integrity, is very important. So that's kind of like the one-liner, is it's DNA damage that they're looking at in the sperm.
And the hypothesis then is that that would lead to essentially like some form of aneuploidy, like some challenge with the embryo forming normally. Is that kind of, okay. So is there,
yeah.
Oh, go ahead.
So yeah, I was going to say that that would be the most extreme if it causes aneuploidy, but it could be subtle things wrong also. It could be causing certain mutations in genes that are important in embryo development as well. So it might not be as obvious as, yeah, you have an extra chromosome or a loss of one, but that definitely is the most extreme sort of DNA damage. But there could be subtle things also that are wrong with the actual sort of in a smaller scale, fine scale.
So is there a way currently, and maybe the answer is no, but is there a way to know for a specific pregnancy loss whether that loss was related to something that had to do with the quality of the egg versus the quality of the sperm? Is it possible to know like whether it was a male or female partner that was contributing to that?
Sure. So when you send for chromosomal analysis, some of the tests, they have what they call SNP arrays, where they take blood from mom so that they can tell whether the aneuploidy, the abnormal chromosome, came from mom or dad. So they're definitely, you can do that next step to see potentially, was it a paternal or maternal abnormal extra chromosome.
Got it.
Or lack of chromosome.
So, okay, so the next question then, the DNA fragmentation, the test, which I have more questions about in a minute, but is that something that, I guess my first question is that something that you would recommend to all couples that are dealing with recurrent miscarriage, or is this an assessment that you think should be more specified to couples that have like certain history or certain types of losses?
So, so basically, there have been 13 different studies over the many years to look at sperm DNA fragmentation and recurrent pregnancy loss. And what they've noticed is definitely men or partners of recurrent pregnancy loss couples do show an increased risk of having increased sperm DNA fragmentation. Not everybody. Um, and so these are unexplained recurrent pregnancy loss patients. So, so what I would say is that there definitely is an association. Can we tell if that the sperm DNA fragmentation led to the pregnancy loss? You know, we still have to do studies to really look at that mechanism.
Mm-hmm.
There are multiple sort of studies such as aging. So older men are more likely to have increased sperm DNA fragmentation, and they're also increased risk of having more miscarriages,
Mm-hmm.
not just current miscarriage, but miscarriage in general. So, you know, there definitely is evidence that suggests this. And in my my routine workup, I do now offer all my couples with recurrent pregnancy loss that opportunity to do the sperm DNA fragmentation as a, you know, this has been an association, and, you know, it's not, we don't have hundreds of studies to show that this for sure is a cause, but it is a risk factor. And actually the European equivalent of the Society of Reproductive Medicine in Europe, in their recurrent pregnancy loss evidence-based workup, they do say that, you know, a sperm DNA fragmentation can be used as a tool to give an answer to patients. Like, this could possibly be, you know, part of the reason. So, you know, given that, I know that ASRM hasn't suggested yet, but their bulletin is 2012, so hopefully they'll come up with a new one soon. I think with that respect, I feel that I would definitely offer it to all my patients with recurrent pregnancy loss, as to give them a, you know, at least potentially an answer. I mean, if it's totally normal, then we can check that off our list. But if it's abnormal, then, you know, we have more evidence. Maybe, you know, there is this wrong and then this wrong, because I think recurrent pregnancy loss, it's unlikely to be just one thing wrong with the couple that's leading to recurrent miscarriage.
So, and that's sort of the next, I guess that's the next question, is like, you do this analysis and you get back, like, what's the nature of the results that you get back, and then what's the course of action? Like, how does that change treatment protocol going forward based on the results of a DNA sperm fragmentation test?
Sure. So currently there are 4 commercial tests, and so you know, different. So that's the issue with looking at sperm DNA fragmentation, because in the studies, different researchers have used different tests, and they're not all the same, like comparable. They measure different things. So, I think that there are a couple that are less commercially available, but they seem to be more sensitive. So there's the tunnel staining and the Comet assay. So those are 2 that have been shown in studies to be much more sensitive. And then there's a sperm dispersion, sperm chromatin dispersion assay, and then the acridine orange sperm DNA fragmentation assay. And it skips me what the test is, but that is the one that I have been using, because that's a lot of it's much more available. So the Comet assay and the tunnel is really not, they're both, there is one, the Comet assay is commercially available now, but it's in Ireland. So that is kind of to get that. But I have spoken to the company, and they're hopefully gonna have a US office at some point. And then the tunnel staining is really only if you run it in-house. For research studies, people do it as a research study, but there is no sort of, I haven't found a commercial place where I can say, hey, I'm gonna send my patient's sperm for the tunnel assay.
Yeah.
So I'm using right now one through ReproSource right now, and so they give you and I must say that I'm not any commercial. I'm not endorsing that should be
One of our organizations is endorsing any particular product. Yeah, fair.
the product. I want to just state that there, but they have a scale and of sort of normals. They've done it on X amount of fertile men, and here's the normal scale. And so I think the upper limit is 20% DNA fragmentation, and above that is abnormal.
Okay.
And so, yes, what to do? So a lot of the studies have shown, yes, there's abnormal sperm DNA fragmentation, but we don't have the studies of what next to do. So that is the next stage, is you have to identify the problem first, and then you figure out what are we going to do next. And what I've been, so obviously we look at lifestyle, okay? So smoking, drinking alcohol, any environmental exposures could lead to that could lead to increased sperm DNA fragmentation. So we look at sort of how can we, and age, obviously the older the guy can have, and you can't really turn the clock back. And then sort of weight, we want a healthy weight, because we know that men with who have obesity can have more likely to have miscarriages, and so they could potentially have sort of more oxidizing sort of stress that leads to sperm DNA fragmentation. And there are some studies that suggest that can be an association between obesity and abnormal sperm DNA fragmentation. So definitely look at lifestyle, where we can improve. And then I would say that the next step is that there are some really, I was recently participating and listening into ESHRE, which is the European Society of Reproductive Medicine. And there's a lot of interest in sort of how to sort the sperm, and there's these microfluidic devices which can significantly decrease sperm DNA fragmentation, improve quality. So I have, sort of added that to potentially, if, you're trying to, cut out all the lifestyle things, and that potentially could be a possibility, because the studies have shown that it can, some of these microfluidic devices have shown to decrease sperm DNA fragmentation to minimal levels, like nearly 0%. So I think that we need to do studies to look at sort of, let's identify the men who seem to have abnormal sperm DNA fragmentation, who have recurrent pregnancy loss, and let's sort the sperm to see if that improves for that, because then that will give us the answer, is that the mechanism?
Okay, couple follow-ups there. So first of all, there's this part of me that's like, I love that now the male partners are getting all of the same lifestyle change advice that the women are getting, because I feel like so frequently the burden of care is always on like the female partner. It's like, change your diet in this way and take all these things. So I guess first question is, as we've talked, some of these tests are not commercially available, often not covered by insurance. So the couple is going to be paying out of pocket to have these assessments done. So if a couple is not able to make that choice, you mentioned, stopping smoking, reducing alcohol consumption, weight reduction. What other kind of lifestyle things can people do themselves without even having to worry about the results of this test, just if they're not in that position?
So So, I mean, there has been a lot of interest about antioxidants being used in this. However, for the infertility patients, at least, a recent randomized control trial hasn't really shown any benefit of any of these antioxidants working. So, you know, does it do any harm by doing these, so the antioxidants? Probably not. And if they wanted to do that, I think, but it hasn't been shown to be any benefit for infertility patients. We don't know about recurrent pregnancy loss patients.
Mm-hmm.
So yeah, I couldn't speak to sort of specifically for recurrent pregnancy loss and abnormal sperm DNA fragmentation.
Okay. And then, as you've pointed out, like, we know that there's an association, but there's not the science to show that there's a direct link. So if you've gotten the results of these things back, is this a type of situation where people should be, as you mentioned, like sort of sperm sorting and going through more of a in vitro fertilization route and selecting like better quality of sperm? Like, what's the kind of what's the go forward course of action for couples that you've assessed them for other factors, they're sitting in that unexplained bucket, and this is maybe the only thing that's showing possible associations with their losses?
Sure. So the microfluidic devices can be used with insemination or IUI cycles. So I definitely think that because, a lot of time my couples with recurrent pregnancy loss are getting pregnant on their own. It's not that they have infertility and they're struggling. And so I don't think you necessarily have to go to IVF yet. You could try an IUI with sorting the sperm. And I think that for me, that would be kind of my next, usually if I still haven't seen anybody with a very abnormal sperm DNA fragmentation yet, that would be what I would suggest is let's try an IUI, because you're getting pregnant. That's not the issue. It's getting the better quality sperm. And IVF is not necessarily sort of the treatment for recurrent pregnancy loss off the bat. So I would say, let's try this, and because it's less invasive and we're still accomplishing sorting the sperm. And so I think that would be my first line, is to do the lifestyle modifications. Let's try an IUI with the sperm sorting and see what happens, because you don't necessarily have to jump to IVF point.
If couples are at the point, so I first of all, I agree with you. And I think sometimes there's almost an anxiety that people have when going to a fertility doctor that all roads are going to lead to IVF. So I appreciate that. Yes, for this population of people, like we're getting pregnant. And so that's not, when all you have is a hammer, everything's a nail, not necessarily the case here. But for people that are going through that process, is it still worth it to kind of do the assessment of DNA, of the sperm DNA fragmentation at the point of, fertilizing embryos and testing them before implantation? Like, is there a benefit at that point as well, the same way with sorting before you would do an IUI?
I think yes. If you're already in that IVF pathway and your sperm DNA fragmentation comes back abnormal, and I would say that there is evidence suggestive that it may play a factor in infertility as well, especially if I have couples who are unexplained infertility and their embryos are poor quality, and everything is normal. She is young and there's no obvious reason. Then it has been shown that potentially men with abnormal sperm DNA fragmentation are more likely to make embryos that are poor quality. And even in the IVF population, there's just an increased risk of miscarriage, not necessarily recurrent miscarriage per se, but there is an association between abnormal sperm DNA fragmentation related to just one miscarriage, more likely to have miscarriage than someone who doesn't.
Yeah.
So I think that I have definitely had couples where we've used the microfluidic device to sort the sperm. Again, you know, we don't have the large studies to say, yes, it makes a difference in live birth rates. However, this is how I think about sort of recurrent pregnancy loss, that it needs to be a personalized approach. It's not one size fits all, to be honest.
Yeah.
And every couple is probably unique. And so if, you know, we're trying to optimize all different factors. So do we optimize the woman? Is it the endometrium? You know, is it the embryo? But we also need to sort of improve it potentially if there is pathologically something not quite right with the sperm. It may be great count, great motility, but there's abnormal sperm DNA fragmentation. That's obviously telling us there's something not quite right, even though we haven't got the exact mechanism that this causes this. But there's a signal of some sort suggestive, and it you know, sort of, it's backed by many sort of animal studies, because we can't really do those studies in humans. You know, you can't expose the sperm to ionizing radiation and, you know, let's check it out. So it's just not feasible to do those studies. So we extrapolate a lot from animal studies, but sort of in my sort of research, scientific sort of hypothesis driven, it makes sense that if you have DNA damage, when you get to fertilization and making an embryo, that can be transferred to the next generation unless somehow it gets repaired. And I would say here is, I think that the egg obviously is very important in this, and it can repair DNA damage. So if you have suboptimal eggs, then that also plays a factor.
Yeah.
And a really interesting study, so there's another way of sorting sperm. It's called PIXI, and it's sort of, you put the sperm and it binds to hyaluronidase. Hyaluronidase is basically sort of what you see, sort of that the sperm should sort of bind to, and then it activates it. And they've done a large randomized control trial in the UK on unexplained infertility patients, and they didn't find a difference between the PIXI sorted sperm and the unsorted sperm. However, they have gone on to look at a subgroup of older women, and that in those older women, it made a difference in miscarriage rates between the PIXI sorted and the non-PIXI sorted. So yes, an older egg is not going to repair the DNA. So therefore, I mean, this is my thoughts of this data, which is really interesting, is that if there was something abnormal sperm DNA fragmentation in the sperm, it made a difference to sort out the sperm because the egg was not really good at repairing it. So maybe that made a difference in those couples. So I think, you know, I think that there is definitely, you know, more research to be done in this area. And I think it's really exciting that, you know, maybe we could identify actionable sort of male factor that's, you know, we just assume that if it looks normal, it has everything, it looks great, then it's fine. But it's not the end of the story for sure.
So, and that's where, you know, I hear that and I'm like, and that's where the conversation is starting to really, as you pointed out earlier, like evolve into more personalized but coupleized types of conversations where it's like there's something that's maybe going on in the interaction of these two humans and their you know, attempt to procreate that is specific to them, not necessarily generalized to the entire population type thing. Yeah. I wanted to ask a question though, you know, like, so people are at different phases of their journeys. And so maybe, you know, if you're kind of at an earlier stage and you're in the process of getting evaluated, it's nice to have this as an option to consider in the toolbox. I think about, like, you know, I'm in a different place and I've got some embryos in the freezer and they've been tested, but we never went through any DNA fragmentation analysis. Like, we just looked at mobility, morphology, things like that. Is this something that is DNA sperm fragmentation still potentially impacting or have a role to play in like my frozen embryos, even if they've been tested for like pre-screened?
Sure. So, the genetic testing is looking at chromosomes. So, if it's a more subtle, if it's at the single gene level, like you have a bunch of genes that are mutated, it's not going to pick that up. And so, I think that that is the unknown. And to be honest, even the genetics of a miscarriage, we're at abnormal chromosomes and normal chromosomes. We
Yeah.
haven't looked at the single gene, or we're starting to, look at sort of copy number variants, which are shown to be important because they may disrupt genes. So I think we're really at a very basic level at our genetic analysis at this point. And so I think that we will definitely have more information as, there are several NIH studies that are going to be looking at genetics and recurrent pregnancy loss to really delve really deep into not just chromosomes, but copy number variants, single gene mutations, and sort of other sort of really finer detail to really check out sort of are there other genetic reasons why miscarriages happen? And most likely there will be, because the whole chromosome, yes, that's obvious reason, but there are going to be smaller things that are like mutations in really crucial genes that are going to stop embryo sort of stop development. And so we know that from many animal studies that knocking out genes which are vital can cause pregnancy loss. So there are many things we don't know for humans. And so I think hopefully in the next 5 years we'll be finding out whether these crucial genes are important in humans, and we can identify in humans, are they associated with miscarriage? And I think that in the future, we'll have really in-depth genetic testing of our miscarriages to really, figure that out. And so I'm really excited to, sort of learn about sort of what other genetic causes of miscarriage there will be. And I think it will help patients because then we can do not just chromosome analysis, we can do things like whole genome sequencing and really, look at the whole entire genome of miscarriages, and to really see if there is these crucial genes that led to the miscarriage.
Yeah. And I always think, it's like that as we kind of envisioned the organization and like, well, what's the point that as a patient having experienced this, what's the ideal future? Like getting hard information like that. I mean, getting information that we might have had some genetic issue that would have made it challenging for us to have children. Like, of course, that would be really painful. But it also, getting that information earlier might have saved us like years of treatment and thousands of dollars and lots of heartache. So I think that's, I hope to see that future as well. I guess like you mentioned that in Europe, this is starting to become more part of the standard practice, and you anticipate that more of a DNA fragmentation work might be part of standard practice here. I guess a couple questions is, when do you think that transition will happen? And are there other things that you think will start to become more standard practice in an RPL workup that aren't right now?
Yeah, so I think your recent talk with Dr. McQueen, the chronic endometritis, I routinely check for that too. And I think that quite a few people who take care of recurrent pregnancy loss patients probably do that too. I think the change will happen hopefully when ASRM revises their bulletin on recurrent pregnancy loss, and hopefully there will be other potential, like maybe you should look at this because right now in the recurrent pregnancy loss bulletin, they say, just do the chromosomes and that's it on the male. So I think it's difficult because there isn't a lot of hard research, like the evidence base. Like we've done these 100 studies and everybody's like the same, looking at the same thing, because the studies that I talk about, they're very heterogeneous. They may do different DNA fragmentation tests between studies. They recurrent pregnancy loss is sometimes they say 2 or more losses or 3 or more losses. So the heterogeneity is a lot, and that's partly sort of researchers, these are the patients we can get, and so sort of if we. So they've done meta-analysis where they put all the data together, and there is an association, but there is a very heterogeneous sort of collection of studies. So they're not necessarily apples and apples. And so, the ideal would be to have everybody agree, that we're going to do 2 or more losses, and we're going to do, we're going to do antiphospholipid testing on everybody and uterine factor. And so I think, that's the issue sometimes with the recurrent pregnancy loss literature, is that we all have different definitions, what we use. And so I think, so for instance, like in Europe, they count biochemicals as part of the recurrent pregnancy loss, whereas in ASRM, it's still clinical losses. So there are a difference in sort of across Europe versus the US.
Yeah. Well, and to, per our conversation about this, it's hard to, I would imagine it's hard for the society to like put a test in their recommended workup when there's not a clear like protocol for what you do based on the results of that test. It's like, it's good for maybe diagnostics, but if it doesn't impact your treatment, it's hard to say that should be part of a standard workup kind of thing.
Sure. And I think my argument against that is really most of my couples want to know a reason why. Yeah. And I think that's why I like it that ASHRA has included that in sort of like this is something you can do if it's for explanation. Mm-hmm. And a lot of recurrent pregnancy loss couples are looking for just an explanation why this happened. Like, yeah, why is it that I'm having miscarriage after miscarriage? Because it's so important for couples just to understand why it is, so frustrating for them to not know. And it can give sometimes closure to help couples, just to say, hey, this is kind of why, even though I know we don't have the treatment or we don't have the study to say that it's going to change, but at least there's something. It's not this amorphous, don't know why, but you can continue trying kind of sort of with uncertainty.
Yeah, no, that's a really good point. And I think like, and that's such a powerful thing, both to help like alleviate some of the burden of guilt and some of just yeah, exactly. The feeling of it helps you kind of have more information to figure out what the right next steps are for you as a couple trying to build your family. So to kind of summarize a couple of the things, you talked a little bit about the kind of current research or the current open questions as it relates to male factor and recurrent pregnancy loss. Who are you looking to as the experts in this space? Or if people wanted to participate in studies or go someplace to find more answers, where can people go to educate themselves or participate in studies or things like that?
So I think that at this moment, I don't know of any study that is recruiting patients for looking at sperm DNA fragmentation at this point. I personally have written a grant recently and I've submitted that. So I hope that one day that it will be sort of funded, and so that is really looking at two aspects of sperm. One is the sperm DNA fragmentation, and really linking that to the genetics of the miscarriage, because we want to figure out, yes, you have abnormal sperm DNA fragmentation, but does that lead to genomic like instability in your
Yeah.
miscarriage?
Like, how is that impacting the embryo specifically? Yeah.
Exactly. Connecting the dots, trying to. And so I think that is one aspect I would, we will need a decent amount of patience for that. However, I think it will really answer the question, does it impact genetics?
Mm-hmm.
And so that's one. And so the other part is more sort of not genetics, but something called epigenetics. So this is DNA methylation. So this is not changes in DNA, but changes that can that are not in the genetic code, but other things that can change the gene expression. And so those are very flexible and sort of they can be changed by environment. And so those are kind of the epigenetics, the DNA methylation is something that's not hasn't been studied really in our recurrent pregnancy loss. But my other interest is in sort of the placental tissue, and that has been studied that there can be DNA methylation differences in the miscarriages versus normal placenta. And so I'm trying to connect that dot between the sperm and the miscarriage, because it's not just going to be genetics, it's going to be other things as well. So
Interesting. And then to kind of go back and summarize, so, and as I said up front, right, this area of science is a moving target. And so, I also, to people listening, I hope you're feeling the same way that Dr. Mack and I are both feeling, that it's like, this is hopefully helping will help give some people some answers. But then there's also okay, so now what, if you're trying to move forward with this information, what do you do? So I want to come back to, like, are there couples that are, what type of couples might be hypothetically at a greater risk for this, and what can you do proactively to maybe manage this if you're going to try again naturally, or things like that?
Sure. I think, the things that we talked about, the lifestyle, if you're a smoker, if you drink more than sort of 3 or 4 alcoholic beverages, we know from IVF studies that decreases your likelihood of a live birth. And sort of having a healthy weight will definitely sort of help in general to just be to sort of move towards a healthier lifestyle. I think those are sort of what men can do on their own, for sure. So, you were at the NIH,
Yeah.
and they talked about vaping.
Oh.
And so I don't know. Yeah, I think that if, a lot, I wouldn't say a lot, but people are tending to do more vaping than they actually are smoking cigarettes nowadays, because they think it's safer. But given the talk that I heard at the NIH symposium about early pregnancy loss, I think there is potential to quit vaping too, to just decrease that risk as well, because we don't know sort of the effect on human sperm per se. So I think, there's just the very, I guess, things that you would think that you should not do, then you should do it.
Yeah.
And so I think anything, so quitting, I mean, anything you don't think you should be doing, then you shouldn't do it. is my advice, and be, you know, as healthy as you can be. And I think most couples, once they have a diagnosis of infertility or pregnancy loss, they really look at themselves. And I have many of my patients are like, oh, we're gonna do clean living, and you know, they feel better for it, you know. And you know, even if it doesn't necessarily significantly help, you know, what you're having issues, but I think, you know, you'll probably feel better in yourself, sort of from a health wise as well. So yeah, I think that hopefully in the next few years we'll have more information about male factor, sort of specifically sperm DNA fragmentation. What's unique also, which I didn't really want to get really into the weeds of it, there are two types of sperm DNA fragmentations. There's single-stranded and they're double-stranded. And it's interesting that a couple of studies have really suggested that recurrent pregnancy loss couples, the men have more likely to have double-stranded breaks than the single-stranded breaks, so single-stranded breaks are more to do with the oxidative stress, such as like smoking and all those things. But the double-stranded breaks there might be some genetic issue with spermatogenesis. So it's kind of interesting that they found there's a difference if you have recurrent pregnancy loss versus the other DNA fragmentation found in infertility patients. So
and maybe surprising that I mean, like, yeah, that's interesting. So we're coming sort of up on the end of the hour. I guess any kind of closing thoughts that you would have for either couples that are dealing with recurrent pregnancy loss, or physicians that are evaluating patients that are dealing with this, other healthcare providers, like, what advice would you have for those two groups as it relates to thinking about male factor?
Sure. I think when seeing a couple with recurrent pregnancy loss, definitely look at the lifestyle of the man, the age of the man, because I think those simple things, you know, you could identify potentially a source, because a lot of the recurrent pregnancy loss workup is just focused on the woman. And I think really it's time to really take a step back. So similarly in infertility, we look at the guy, and 40%, 35 to 40% is male factor. So it would be reasonable to think that recurrent pregnancy loss, there is potentially a 30-40% due to the man.
Yeah.
So that would be my closing sort of statement would be, I encourage people to do a semen analysis and plus minus sperm DNA fragmentation, depending on sort of resources for your patient. But I think there's growing evidence that there is an association. And so I think it's helpful just to look at that side of things. And sometimes I think that for if you find something abnormal, then it helps the patient think about the lifestyle changes, because they may think, oh, if my sperm is looking great, I don't need to stop smoking.
So probably would have been like that. Oh, it turned out fine. That means I can still enjoy my Jameson. Yeah.
So bit more, when people see abnormal tests, then they're like, oh, maybe I should change that. So I think, it helps. Any sort of information is helpful.
Yeah.
And I do find that, a lot of times, I'm talking to the females in the couple, and so they're always saying, oh, please, if it comes from you, Dr. Mack, to quit smoking, it'll be it's not like me, I'm being a naggy wife. So I think, if you have an objective abnormal testing, then it gives people more incentive to look at the lifestyle changes. So, as a counseling tool, I think it's still important, because we don't know the impact of these other lifestyle changes. There's no study that has shown, well, if you quit this, recurrent pregnancy loss is better. No one has done that.
Right.
And that would be a really hard study to do. But we know that smoking impacts quality of sperm. That's just, that's
Yeah.
something we've always known about. So, so yeah, and I think, you know, it helps to focus more on the couple and not just on the woman. I think a lot of my patients, you know, they're feeling so guilty, something with me. And then if we sort of like expand it to, we think it may be a couple thing, then I think it's more inclusive. Um, and it helps to share the burden.
Yeah. Yeah.
It's not just her. It could be him, or it could be a combo.
Right, exactly. And that, you know, it just gives more of that element of like a team approach and looking at, yeah, I love that. I think that that's such a, um, it can even within a couple, having the experience of recurrent loss can make you feel like alone inside your partnership. And so, yeah, I think that that's really important. Um, Thank you so much. This has been I think it's, you know, it's fascinating. Science never moves fast enough for the patients. So I know that people listening might be like, no, but I want the answer sooner. But it's so interesting I think it's really important for the couples that are going through this to understand where the science is at and what are the open questions and how can they inform themselves, but also be able to have more intelligent conversations with their care team. And so I thank you so much for taking the time. I'm going to do another plug for anybody listening. Please follow Dr. Mack, Miscarriage MD. So thank you so much. I appreciate your time.
Well, thank you, and
Given us. Yeah.
sorry.
I said, and all the help that you've given our organization also, like, such a champion for us.
Well, I thank you for inviting me, and you know, this is kind of well, why I started Miscarriage MD is really to educate patients and give them a glimpse of the research, because it's sometimes, you know, you know, you go on and you Google, there's so many things out there, and it's sort of difficult to really know what's real and what's not. And I would say male factor right now is in its early stages. And so, but I think as physicians, you know, I think we're going to progress towards looking more at male factor as a factor in recurrent pregnancy loss, as we do in infertility nowadays. So yeah, thank you very much, and I look forward to future conversations.
Awesome. All right. Well, have a good rest of your evening, Dr. Mack. Thanks.
Okay, bye.
Bye.